Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Now we're going to understand the intra-arterial septum, intra-atrial septum. So before we move ahead, let's understand the diagram and label it and then move ahead with the explanation. The top structure protruding is the septum primum, and below it lies the OP, that is the ostium primum. Next, below that, there is nothing but the endocardial cushions. So this forms the base. So this is the first image we are seeing. Next, there is the septum secundum as well as the empty space, that is the ostium secundum. Now this space is known as ostium secundum. Lastly, the development, there is again the septum secundum, and there is a small gap. This gap is known as the FO, that is the foramen ovale. So our discussion is going to be based on these images. So first, what are the procedures which are happening? So first is the intraatrial septum. It develops from the, so there is interarterial septum. So this intraatrial septum, it develops from the septum primum as well as the septum secundum. Next is the septum primum. It begins at development of the 28 weeks. So septum primum, it begins to develop at the 28 weeks. It is a thin crescentric fold of the endocardium. It is a thin as well as a crescentric fold, and this is of the endocardium. And it arises craniodorsally. So this arises craniodorsally. So it arises craniodorsally and grows down the AV cushion. So it grows down to the AV cushions, and it leaves the ostium primum below its free edge. And it leaves the ostium primum below its free edge. So this is all mentioned in our labeling. So we have the septum primum, there is ostium primum as well as the endocardial cushion. Next, there is the septum primum. So this septum primum, it fuses with the AV cushions. So septum primum fuses with the AV cushion. So AV cushion, and this happens at approximately 35 days and obliterating the ostium primum. So it obliterates the ostium primum. Next is the ostium secundum. The OC ostium secundum is an opening of the upper part of the, so ostium secundum is nothing but the opening of the upper part of the septum primum. So it is opening of the upper part of the septum primum, and it forms in about 33 days. It forms in about 33 days, and that is before the ostium primum closes. So it is before ostium primum closes. Next, what we have is the septum secundum. The septum secundum, it is a thick muscular septum. So it is thick muscular septum, and it arises from the right of the septum primum. So it is right of the SP, that is the septum primum, and it grows from the roof of the atrium but does not reach the AV cushion. So it grows from the roof. So it grows from the roof of the atrium but does not reach the AV cushion. So it does not reach the AV cushion. And the gap between the two septa is known as the foramen ovale. So we have this, we have discussed. So the gap between them is nothing but the foramen ovale. After birth, the foramen ovale, it gets obliterated. So after the birth, the FO, that is the foramen ovale, it gets obliterated, and this obliteration is by the fusion of the septum primum with the septum secundum. This is by the septum primum with that of the septum secundum. So in terms of the adult anatomy, the annulus ovalis, so there is an annulus ovalis. So this annulus ovalis, or the limbus of the fossa ovalis, is the lower free edge of the septum secundum. So this forms a lower free edge, and this is of the septum secundum, while the floor of the fossa ovalis represents the septum primum. So the floor, it represents the septum primum. To watch more videos like these and grow daily, subscribe to the Dr. Hub channel.